Hello, I'm Dr. Molly Long, and I'm one of the physicians with Women's Care Florida. My practice is located in St. Petersburg. So you're waking up at night hot, you're throwing off the covers, you're turning down the air conditioner, and you're wondering what's going on. Well, you may be going through menopause. Some of the symptoms associated with menopause are the hot flashes. You can also get vaginal dryness, irregular menstrual cycles, or a complete stoppage of your menstrual cycle, as well as fatigue, loss of energy, mood swings, and difficulty sleeping. What can you do to help these symptoms related to menopause? Well, some of your treatment options would be to get regular exercise, eat healthy. You could consider low-dose antidepressant, which actually does help with the symptoms of hot flashes. You could also try yoga or acupuncture. There are some herbal therapies that will help with your menopausal symptoms as well, which mostly contain black cohosh or soy-like products. The more common way to treat your menopausal symptoms would be to do hormone replacement. Hormone replacement involves hormones of estrogen, progesterone, and possibly even testosterone. Estrogen helps eliminate hot flashes, also vaginal dryness. It may help prevent osteoporosis and possibly colon cancer. Progesterone is necessary to take along with estrogen if you still have a uterus to prevent you from developing uterine cancer over time. Testosterone is a hormone which is currently not FDA approved for the treatment in women, but is available as a bioidentical hormone from a compounding pharmacy if you choose to treat with testosterone. Testosterone mainly treats low sex drive and can help with energy as well. There are some potential risks that are associated with taking hormone replacement therapy. In one of the large studies, they did show that there was an increased risk of heart disease and stroke in women over 60 who did take hormone replacement therapy. However, there may actually be a cardiac benefit for women under 60. There also may be an increased risk of breast cancer when you take hormone replacement therapy, especially if you take it for more than 5 years. You should discuss your individual risks and benefits of taking hormone replacement therapy with your personal physician.